The Wound Center at GBMC uses the most up-to-date technology to heal the body. With a caring staff and state-of-the-art treatments, the center boasts some of the best healing rates in the area. And here to discuss what makes it stand out is Dr. Jennifer Heller, the director of the Wound Center. Welcome.
Thank you so much. Good morning.
I'm happy to have you here. This is something that I feel like people don't really know a lot about until they encounter it. So talk to us about what a chronic wound is, like what constitutes that.
Sure. A wound, first of all, is an injury to a tissue in the body that results in an opening of the skin, and it can really be anywhere. A chronic wound has to do with the time that the wound is still present on your body, and that is about 3 months or so.
Okay, so if it's not healing up, then it becomes a chronic wound.
That's exactly right.
Okay, so how do you treat a chronic wound?
It depends on a lot of different factors. So even though a chronic wound is defined by 3 months of not healing, we generally recommend for patients that at the first sight of a wound that may be concerning to them, be it its appearance or smell or pain, that they certainly should call us, and we would be delighted to see them. There are factors that impede or slow wound healing.
That's what I was going to ask you. Why would this happen?
This would happen due to a variety of different issues. One is certain medications. So if people are on blood thinners, for instance, such as Plavix or Coumadin, aspirin, a lot of us are on a lot of these different blood thinners, that can not only cause a wound, but can also prolong that wound from healing because there's blood collecting. Steroids is also an issue. Life factor choices such as smoking can also slow wounds from healing properly, and other medical conditions such as diabetes and heart disease.
So if we notice that on our body or on a loved one's body, what are the next steps? We call you or go to our primary care? What happens?
Either way is great. Certainly if you're concerned, we would always be delighted to see you. We do have a policy that it's always better to see the wound in person rather than to talk on the phone. And we have a rule that everyone gets seen within 2 business days. So if you have a wound, we don't want you to sit and be concerned about it. We want to be able to meet you, talk with you, and get you started.
Well, that's really comforting because I feel like a lot of people would put that off or make the call and then they have to wait and you sort of get disillusioned. You just want to get taken care of. So within 2 business days is huge.
Within two business days, that's right.
What else sets the Wound Center apart from other wound centers?
Well, certainly we in Maryland are lucky and privileged to have a lot of great medical communities. But I think what makes GBMC Wound Center very unique is the fact that we have a comprehensive care center. Our nurses have decades and decades of experience, not just in clinical nursing, but also with specific wound care. They have sought advanced wound care certification. And from a doctor's standpoint, we have physicians who hail from many different specialties: podiatry, plastic surgery, and vascular surgery.
So they're all working in consult together to help these patients.
Exactly.
So you also have something, and I love this, it's a Lunch and Learn series. So it sort of peels back the veil and lets people know about the Wound Center and how you can treat. Can you talk a little bit more about that?
Sure, I'd love to. They're called Wound Wednesdays. They're held the first Wednesday of every month. And we have lunch and an education series. Our next one is July 3rd. And it talks about diabetic diet options. But in the past, we've had first aid for your wound. Dishwasher doors tend to be an issue. And so what happens when you develop a wound after you hit the bedpost, after you hit the dishwasher, what to do first before you come and see us.
Right.
And so we'd love to invite the community in to chat and answer any other questions that they may have.
So this is open to the community, and all they have to do is RSVP, correct?
That's correct.
All right. So if you want to, you can register today for that upcoming Lunch and Learn. Just go to gbmc.org/wound RSVP. So then they can RSVP right there. You've got the Wound Wednesday on July 3rd and also August 7th. So you can sign up now. Thank you so much for being here.
Oh,
really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.